And a very good morning. Welcome to New Jersey Viewpoint. I'm Ken Rosato. Today we have some special information that applies to financial planning as it applies to aging parents. We'll also have with us our own meteorologist, Bill Evans, and his new book, Category 7. But first, preventing cavities and gum disease is a perennial issue that plagues us all. Some New Jersey dentists are describing themselves as starring in their own CSI or crime scene investigation, and the crime in the question is the killing of teeth and gums. Joining us in our studio is Dr. Andrew Spector from Gentle Dentistry in Haworth. Well, Dr. Spector, what is gum disease first off, and is it something that we're finding is causing more problems today, say, than years ago, or are we just more on top of the issue?
Well, I think gum disease is something that is dangerous for patients because it's something that many times goes unnoticed. You can lose 70–80% of the bone around your teeth, and they can still be relatively tight until that last moment where they just release, and you have a very, very big problem. So looking at gum disease today, we want to go ahead and prevent it based on the risk factors that the patient presents with. So if we know that patient's risk factors, we can go ahead and determine what their potential for tooth loss is.
So what are those risk factors?
Well, the risk factors tie into heredity. There is a general tie to family history, so we take a complete family history in terms of the risk factors that are involved. We basically go ahead and measure the gum pockets around somebody's teeth. Anything deeper than 3 millimeters is not going to be cleansable for the patient. They can't reach it. So what happens? Things sit underneath the gum, you can't reach it. The bacteria produces acid. The acid basically melts the bone, and you don't know that that's happening. Maybe you get a little bleeding or puffiness, it goes away, and in that short period of time, you might have lost 10 to 20% of the bone.
That's an awful lot, obviously. And in a case like that, now you have, I'm sure, a lot of cases of, say, receding gums. Now, is that a situation where that little recession of the gums is enough to potentially cause a rapid, say, loss of bone?
When gums recede, bone goes with it. So that is just something people should know. And why do gums recede? People, dentists used to say, well, it's toothbrush abrasion. You're brushing too hard. The bristles are too hard. People should use soft brushes. But a lot of times it could be biting, the way their bite comes together, parafunctional habits in terms of grinding at night, things that can be handled with night appliances just to protect the teeth from the stress and force that would make the earth disappear from the telephone poles, so to speak.
Nicely put. And, years ago, I guess people just took it for granted. They just assumed you get old, you lose your teeth. But that doesn't have to be the case.
Doesn't have to be the case, and this is the beauty of it. We can now go ahead and define somebody's future based on risk through a national database with Previsor services. Previsor services have gone ahead and tracked people over many, many years in certain risk categories and documented what their tooth loss or rate for tooth loss has been. So we can now go ahead and instantly take the patient's risk factors, email it over to the database, and get a comparison for risk category 1 to 5, 1 being healthy, 5 being a very high risk of tooth loss in their life, and then tailor their treatment appropriately for that patient.
You wrote an article about CSI, the CSIs of this, and so these are some of the issues I'm assuming you tackled in this article.
Absolutely.
What are some of these other risk factors?
The other risk factors that we are looking at in terms of cavities, let's go to that realm, would be a low pH in the mouth. Cavities form because the mouth is too acidic. If the pH goes below 5.5, you're going to get a cavity. So if we can go ahead and diagnose if somebody has an acidic mouth prior to them ever getting a cavity, we can reverse that and put them in a situation where their mouth is going to be healthy.
Now, I've seen a lot of zinc washes and peroxide washes, and what's good for folks to use?
It's dependent, again, on the risk factors. There's two things. There's a balance. You have things that will go ahead and get rid of the acids in your mouth, and there are things that are going to go ahead and bring up the protective capacity of your saliva, so to speak. So let's quickly talk about those two things. Number one, things that will help reduce the acid in the mouth. If you're in between meals, you're not near a toothbrush, sugarless chewing gum with xylitol in it. There was one gum company that just got ADA approved. Whether it's Trident, Orbit, any of these that have xylitol, it breaks up the ability for the bacteria to cause acid.
Fascinating.
So it will bring the pH or keep your mouth neutral or bring it back to a neutral pH where you're protected. So that's one thing you can go ahead and use. Obviously, all the home care stuff is wonderful. Any of the brushes oral irrigators like Waterpick are well used and will go ahead and help.
We only have about a minute left. What is the laser fluorescence technique?
Laser fluorescence technique, what we like to do is we are finding things before they show up on x-rays. Bottom line is that x-rays are a 100-year-old technology that only shows gross decay. It does not detect early decay. So what we tend to find is we will find with the laser cavities or bacteria underneath the surface of the tooth before it shows up on x-rays. We're catching the cavities earlier, we're able to treat them earlier, treat them smaller, save more enamel, and have a healthier patient.
So talk to your dentist and ask him about all these techniques or her about all these techniques. Keep those teeth healthy for a long, long time. Dr. Spector, thank you for being with us again from Gentle Dentistry in Haworth. Again,
much appreciated. Thank you.
Well, we will be right back with information on baby boomers and the need for financial planning for aging parents. Be right back.